Good afternoon, everyone. I want to welcome you back to our latest edition of the CARES Cafe. ASU Ocher's Tucson CARES team and the YMCA of Southern Arizona present this series, mirroring the in-person work of Tucson CARES embedded drop-in space at the Tucson House, Tucson's largest public housing community. The CARES Cafe acts as a linkage to resources promoting health and wellness. We'll invite community health leaders to discuss services, resources, and innovative approaches to improving mental health and physical health aimed at benefits for residents of Tucson House and the community at large, from guided meditation to Medicare assistance. This week, we proudly feature Courtney Spector with P3 Health Partners. P3 Health Partners Arizona is a population health management company supporting 50,000 plus Medicare Advantage patients across the state of Arizona. Through their contacts with health insurance plans, P3 Arizona's vision is to lead the transformation of healthcare. Join P3 Arizona's Courtney Spector today to learn more about P3 Health Partners Arizona's leading the way in managed and coordinated care. And Courtney's prepared a great presentation for you all today. So without further ado, I'll let her jump right into it.
Thank you, Bob. And hello to everyone tuning in. I so appreciate the time and attention to talk about P3 Health Partners Arizona and some of the fabulous work we're doing, not only for the Tucson community, but the Southern Arizona community and the state of Arizona at large. So I am going to go ahead and share my screen. You're going to see the Zoom here first, and then let me do this here. Bob, give me the thumbs up. Can you see? Oh, actually, you can probably see presentation mode, huh? Let me share the different screen here. You want to see this screen? Thumbs up?
Looks great. Yep, looks great.
Okay, let me make sure that share sound is on. Okay, so thank you again for having me. Again, my name is Courtney Spector. We will have a time for questions at the end, so please kind of write things down. And if I'm talking too fast, maybe you can denote in the chat or give a hand raise or something like that. But P3 Health Partners Arizona, we are a population health management company. What does that mean? That means that we manage a population of people for health plans. We contract with a handful of health plans across the state of Arizona and basically provide added value resources and support to people that are enrolled in those health plans. And we'll go into further detail about that here shortly. We also partner, in addition to our contracts with the health plans, we partner with primary care providers. We have over 1,000 primary care providers in the state of Arizona that are in our network, in which I'll kind of explain that a little bit later on as well. But our network is quite large. We have very, very large groups here in Tucson, such as El Rio, MHC Healthcare, TMC1, and then we also have your smaller one doc shops as well. And we provide extra support and resources to those primary care providers that give them extra resources to see and help their patients when the patients aren't directly in front of them in the clinic. And finally, we engage and empower patients to help them get the care they need. Patients being you all, being folks likely of the 65 and up age. Our primary focus is Medicare Advantage patients. So if you do have a Medicare Advantage plan with one of our health plan partners, there is a very high likelihood that you could potentially be one of our patients and not even know it. So, and I'll talk about that here in a little bit as well. Everybody always asks, what does P3 stand for? People with passion and purpose. That's the 3 Ps, people, passion, and purpose. So again, we are a population health management company. We work to coordinate healthcare in a very complicated system. We help to connect the dots, both with the patient, you, and with your primary care provider. That connection with your primary care provider is of utmost importance to us. That primary care provider should serve as the quarterback to your health, and we want to help promote that relationship. P3 as a whole, we do have a national footprint. We do operate in states like Florida, Nevada, California, and Oregon, in addition to Arizona. But specifically here in Arizona, our home base offices are here in Tucson and within Pima County. But we also support patients across Santa Cruz County, down in Nogales, Cochise County, Graham, Greenlee, Yuma, and all the way up to Yavapai. So across all of those counties in the state of Arizona, we help support about 50,000 patients. Again, these are Medicare Advantage patients, folks that are enrolled in Medicare Advantage plans. Moving along to, again, talking about how do you become a P3 member. You never really sign up for P3. You sign up for a Medicare Advantage plan, and I'll go through the 6 plans that we contract with on the next slide. And you see a provider in the network. So both of those 2 items trigger you to automatically get P3 resources at no additional cost. It is an added value resource that comes with that Medicare Advantage product that you're on. So for example, we support United Healthcare in Pima County. Within United Healthcare, there are a variety of plans within the Medicare Advantage space that you can say, I'm going to sign up for that plan. So if you're on a specific plan that we support and you see a doctor in our network, say at El Rio or MHC Healthcare, TMC, Banner, you automatically get P3 at no cost. So some of you, potentially could have received a letter from us or a postcard from us, and you're saying, why am I getting this? I go see Dr. Smith at El Rio. How does P3 fit in? And hopefully now you can understand that we fit in because A, you're on a Medicare Advantage plan that we contract with, and B, you see a doctor in our network. So we're kind of the middle person in between those 2, just trying to help connect those dots and better manage and coordinate your healthcare. Again, these are added value resources. These do not come at any cost to you. And I'll go into what those resources are in a little bit. But here are the 6 health plans in the state of Arizona that we contract with. And specifically in Pima County, we support all 6 of these plans. Now, we do have very specific products. The product is going to be the name of the Medicare Advantage plan that you're enrolled in. For example, United Healthcare AARP Medicare Advantage Plan 1. That is one specific product within the United Healthcare line that we support. So it does get a little confusing. We do have a lot of licensed Medicare advisors that we really recommend you speak to, or potentially that we can connect you with, simply because one thing about the healthcare and health insurance world is that every single year your health plan changes just a little bit. Every year you're going to get a letter, an explanation of benefits that's all these pages long, but everything that's either new or changing or potentially has been removed from the health plan that you were enrolled in the year prior. So it's always good to just kind of have a licensed advisor just to talk to kind of go through what's changing. How is this going to affect me? Are my doctors still in network? Are the drugs that I take still covered by the plan that I'm on? And talking to a Medicare advisor costs you absolutely nothing. Those Medicare advisors are paid by the health plans, so they will never charge you anything for a consultation or advisement, just to take a look at that explanation of benefits, or to sit down and just to make sure you're on the right plan for you based on your needs. Your needs being any new chronic conditions, new pharmaceutical drugs you need to take, new medical devices, maybe dental and vision that you want covered. So kind of, again, more than happy to help answer any of those questions. And we have a lot of resources too that can guide you to get to who you need. Most importantly, these are the 6 health plans that we contract with in Pima County. Next, again, I talked a lot about that primary care provider relationship, how important it is to us. We definitely want to fortify that relationship with you and your primary care provider. As I said earlier, they should be your quarterback, running point through all of your specialty doctors that you see. For anything else, they should really formulate a game plan for your wellness, and we want to provide P3, we want to provide that primary care provider extra resources when you're not in front of him or her at their office or in their clinic. We're going to be helping that primary care provider give them more information about you as the patient based on access to claims that we have through our health plan contracts. So we can see when you've gotten a mammogram or a colorectal screening, and we can make sure that information gets back to your primary care, because that primary care provider should have all that information. Again, as the quarterback, they need to know it all, and need to see everything out on the playing field. The goal of this entire thing is to keep you, the patient, as healthy as possible and out of the emergency room. We want you to fortify that relationship with your primary care. So your primary care is the first person that you call instead of, an emergency room visit. That's going to rack up a lot of unnecessary costs and bills that can be very detrimental to anyone's well-being. We also like to engage with the patients from a primary care perspective to talk about decisions on new chronic conditions that they may be diagnosed with, new medical devices they may need, and any end-of-life planning that needs to be discussed. So I know I've talked a lot about these added value resources, how we work with health plans, how we work with primary care providers, but what is the added value resource that I keep talking about? And that is going to be our care management team. So on the next slide, you'll see a bunch of photos of some fabulous P3 staff members here. But our care management team is a group of nurses, medical assistants, social workers, a registered dietitian, that serve you, the patient. So we are here to help you manage any illnesses or a new chronic condition diagnosis. You have a recent hospital visit. Things are a little foggy. You don't really recall what the discharge orders were, what they told you to do. We can walk you step by step as to what just happened and what are the next steps that you need to take now. Maybe it's more physical therapy. Maybe it's helping schedule your follow-up visits with specialty doctors or with your primary care. Coordinating transportation to and from doctor's visits. You need help refilling your prescriptions. Say you were just prescribed something at the hospital and you want to know if that works well with what the medicine that you're already taking. It's really, really important that you can talk to somebody to make sure that all these new medications that you have are jiving with each other. It's so much of the healthcare system can feel disconnected and disjointed. What our care team does is try to step in and connect those dots for the patients. So here is our lovely list of ladies, currently all female, that again, these are the nurses, the dietitians, the social workers. You'll see quality specialists on here. Quality specialists, they're going to make sure that you're getting all those preventative care screenings that you need to have every year, such as a colorectal screening, your A1C. They're going to call, make sure you get your flu shot, those types of things. But this is the team that is kind of the dedicated support staff. This is the added value resource that you get. Every single one of our patients is assigned one of these ladies. You could be lonely and just need someone to talk to. We saw that a lot during the dog days of the pandemic, in which they just needed someone to talk to, and they were able to call this group of our care team to kind of talk through that period of isolation. But again, this just kind of shows you what you might need extra support, and please reach out to us, or B, our team may be reaching out to you, and here are some of the reasons why we're calling you. We can see that you've been recently discharged from the hospital, or you have a recent visit to the emergency room. We can see that you haven't seen your primary care in over a year, and that's problematic for us. We want you to see your primary care 3, 4, or 5 times a year to help fortify that relationship. So it's kind of twofold. One, you can reach out to us at any time for any need related to your healthcare, or B, we may be reaching out to you, and we're there for helpful purposes strictly. So I do have a little video here to show you, highlighting one of our care managers. This is a real patient. His name is Raul Gutierrez that we were able to help with. Let's see if this works here.
My name is Raul Gutierrez, and this is my P3 story. I had just been discharged from a hospital, and my symptoms were, I had no recollection of a lot of things. I was in a fog light, and I don't know how long I was doing that, but I got a phone call that I was not going to answer, but something just said, pick it up. And I did, and that was a blessing at the time, and it's been ever since then. The person at the end of the line, Melissa, just sparked hope. Through her, I got my brain going. I got my, it passed a couple of weeks, and she followed up on everything she told me she would. I felt better, but with her help, I have to tell you, I call her my angel because she really came in at the moment where I needed somebody.
P3 Arizona supports seniors in getting the care they deserve. For more information, contact us today.
Okay, hopefully everyone can hear that okay. But that was, again, one of our a real patient who had been recently discharged from the hospital, and he was in a fog leaving that situation. We were able to do outreach and kind of get him on the right path as to what the next steps were. And obviously, you know, he's just a wonderful man to be able to kind of help share his story with us. So one other item that we help support on the primary care provider side is we have our own wellness center here in Tucson. It's on North Wilmot and Grant Road, just across from the Costco on kind of the east side of town. And we call that our P3 Wellness Center. A visit here with one of our nurse practitioners or our registered dietitian, this helps support when you can't get in to see your normal primary care. You know, you can't get into your El Rio doctor, you know, for a couple of weeks or 30 days, however long that takes. You can come see us as long as you're a P3 patient, meaning you're on the right Medicare Advantage plan and your primary care is in network. That makes you a P3 patient. You can come see one of our nurse practitioners, and we can help you with whatever it is that you're in need of. And then we're going to share all that data and all that information that is collected at our wellness center. We're going to send that right back to your primary care. So again, we're just helping supplement any visits that you're already doing with your primary care, and you can't get in to see him or her right away. We'd be happy to see you in the event that you need to speak to a physician or a provider sooner. We also have a mobile health clinic, which we take kind of all around town. There's an image of that here. In this mobile unit, we do have a nurse practitioner that does what we call comprehensive visits. It's about a 45 to an hour appointment with our nurse practitioner. It's like an annual wellness visit, but a little bit more extensive. We're going to get a head to toe look at what's happening in your healthcare world, and then we're going to share all that information back to your primary care provider. The best thing about a visit to our wellness center or our mobile clinic is the incentives that we provide. If you complete a wellness visit with us at P3, we're going to give you a $50 gift card to either Walmart or a grocery store. But if you also complete this visit at your primary care office and you are a P3 patient of ours, you're going to get that same incentive, that $50 gift card. We will mail it to you following that visit with your primary care. But a visit at our mobile clinic, you're going to get it right on the spot. This is going to be in addition to any of the other incentives your health plans might provide. So a lot of health plans provide gift cards to get your annual wellness visit, to get your flu shot done, your diabetic eye exam, all of those things. So this is something in addition and on top of what the health plans are also incentivizing patients for. I do want to show a little bit of our marketing in case anyone that's watching this now has received any of our materials. Here's an example of some of the things that we do send out. And again, you know, so much of the healthcare space is very diluted with spam and illegitimate companies. And so, you know, it's important to us to get our message out, A, through this avenue, and then B, through to our patients via direct mail pieces. We'll do calls and text messages. And then we have a patient service booklet here as well, all with medically necessary information about comprehensive visits, things we think we need that patient to schedule, such as a mammography, flu shots, things of that nature, always medically related, based on getting the care that we think our patients need to have each year. So if you ever see any of this type of material, that comes from us, and it is promoting and incentivizing, obviously, getting your comprehensive visit, your annual wellness visits, but also this patient service booklet has a long list of really great resources, a checklist of what to bring to your next visit with your doctor, a checklist of all the health screenings we recommend you have each year. It's a really great booklet to help you kind of guide you through each year. Also, what's exciting for us is we have a partnership with University of Arizona. Arizona State in this particular arena, but we do have Coach, the former U of A softball coach. He does do some commercials for us. So I'm just going to play this for you now, and hopefully you've seen it on TV before.
As a softball coach for 36 seasons, I've loved recruiting talent and putting together a winning team. Now in retirement, my key team player is my primary care provider. It's important I see my doctor at least once a year for my comprehensive visit. The team at P3 Arizona helps me stay on track and establish a game plan for my health. When you've got teammates you trust, everybody wins. P3 Arizona supports seniors in getting the care they deserve.
Wonderful. Okay. And then in addition to partnering with Coach Candrea, we also like to invite a lot of our patients out to events that we have. So here's one event in particular that we just had at the Arizona baseball game.
As a softball coach for 36 seasons. The tent with P3 Health Partners celebrating Grandparents' Day, and we're going to have a wonderful afternoon eating pizza and celebrating this wonderful event.
First pitch, and it was a lot of fun. I was very honored. Got all my grandkids here. It's awesome. Thank you so much, P3, for bringing us out for Grandparents Appreciation Day. It's a lot of
I'm going to go ahead and stop that right there. But this was a free event that we offered to a handful of our patients here in Southern Arizona. The event came with complimentary U of A baseball game tickets. You got to join us at the tent, free food and drinks, just a way to give back to our patients. Again, our patients can be anybody in one of those Medicare Advantage plans, and when they see a primary care provider in our network. So that's quite a large group of people. And if anyone has any questions on how they can qualify to be a patient or how they become one, we can definitely answer that question for them following this presentation. So with that, I've kind of left some of our market contacts. Here is my information and my email. My colleague Macy, who is on PTO today, couldn't be with us. And then our care management team, the group of fabulous individuals that help connect all the dots within the healthcare system for you. That is their direct email and their direct phone number. And then our website as well, in case you just want to kind of gather any more information. So with that concludes my portion of the presentation. Bob, I'd love to open it up to any questions or the chat to see if there's any, I will stop sharing here, any other questions that I can answer.
Absolutely. Courtney, thanks so much for that presentation. It was thorough and answered a lot of the questions I think our viewers probably have. It's a little quiet in the chat right now, but I had a couple questions for you. Even though it was the Arizona Wildcats baseball team, that event did look pretty fun. Do you guys have anything like that coming up on the horizon that our viewers should know about?
Yeah, right now it's because it's the summer months and U of A isn't playing too many athletic events. We support all of the teams. So we usually do something for Arizona football, men's and women's basketball, and then something in softball and baseball. So we don't have something on the books as of right now, but we do plan every year to do our grandparents appreciation event in April or May with Arizona baseball. And again, we gave away about 200 complimentary tickets. And how we kind of conduct that is we do a postcard to our patients, and then they can call in to RSVP. We allowed our patients to request up to 10 tickets to help, bring all their grandkids or their family members. You don't even have to have grandkids. If you just wanted to come and join us, everybody was welcome. It was a way to give back to our patients and let them know how much we appreciate their engagement with us, because we truly believe that we're transforming how healthcare is delivered. And that transformation starts with the engagement with us, that patient to P3 engagement. So letting us in is half the battle. But as long as that patient knows and understands that we're there to help, that really helps cross that bridge to getting to a great game plan for someone's healthcare moving forward.
Great. And I know you shared the eligible health plans that offer people that opportunity to get involved with you guys. For people who may have questions about if they qualify or if they're in one of those qualifying plans, can they just ask their primary care physician directly? Should they contact their healthcare provider? What's the best chain of events there?
The best chain of events, I think, is to likely call us, just to see. We have, folks that can help answer those questions for them. Sometimes when they're dealing with large groups, such as an El Rio, they have thousands of physicians in that network. And so that physician isn't always going to know the specific Medicare Advantage products that P3 supports. So it's best to just give us a call. We also have an online inquiry system where you can contact us and see, how do I qualify? How do I get signed up? And then we can do outreach to you from there. What we really like to do is connect you with a certified and licensed Medicare advisor, someone who understands all the nuances of getting enrolled into a Medicare plan. I will say that October 15th through December 7th of every year is the annual enrollment period for Medicare. and Medicare Advantage plans. That's October 15th through December 7th. That is the time every year that you can change from United Healthcare to someone else if you choose, or if you're, with Blue Cross and you want to go somewhere else. That is that window of time that you can make that change, unless you've been diagnosed with a new chronic condition, such as diabetes. You can make that change any time throughout the year. You can also, as soon as you turn 65, you can enroll. It doesn't have to be within that window. So if you turn 65 in April, you don't have to wait until October to enroll. And then also, if you move from county to county, if you move from Pinal County to Pima County, you can enroll in a Medicare Advantage plan at that time.
Great. And we've definitely dropped some contact information in there, website, general phone number, email address. So definitely, if you're interested, reach out to P3 and find out if you might be able to get connected. So yes. Courtney, I know we're up against the half hour here. I wanted to thank you all again for joining us today, sharing that info. And I encourage anybody watching out there today who has any follow-up questions, reach out to us. We'll make sure and connect you all. And thanks for joining us today for CARES Cafe. Courtney, thanks again. Have a great day.
Thank you all so much. We hope we can help you soon. Take care, everyone.